no good solutions, you can go to alternative, but to a specialist first. So I think India is fortunate that we have these good specialists. Many homeopathic doctors are exceptionally talented. I don't discourage it.
In fact, we have one of our colleagues from AIMS. He did MBBS from AIMS, and then he went into homeopathy, and he's a renowned practitioner. There is a question that was raised also by Shiva, and it came from that question, that corner. You know, we have these nurse physicians or nurse anesthetists who can give anesthesia in US. Whereas in India, IMA rewards if you bring in 3-year medical curriculum, let alone a nurse or a paramedic, give some prescription. How do we see this?
It's a very good question. It depends on your year of education. I'll tell you, once I landed in Boston and I was going for our American liver meeting. So the girl who was driving, it was 9 o'clock in the night, she asked me, "Are you a doctor?" I said, "Yes." I said, "How come, why are you asking me?" I said, "I'm going for this meeting." She was a nurse. She was in 3rd year of her nursing career. I said, how are you trained? What do you do? I have been given an assignment in which I failed. So what happened? My job was to see that there is a patient and she was to prepare a 1-week course. I am lying down. Suppose the patient falls. What are the liabilities and how do I prevent a patient, 80-year-old patient, from falling from a bed? She said, "I prepared everything, I videoed, I captured, but I made one mistake." I said, "What mistake?" "I forgot to tell the patient that you can fall." I did everything, but I did not tell the patient that, "Look, you are 80, you may fall." So I failed.
RMP, acupressure, acupuncture, magnetic.
No, please, the message is that the sensitivity of a nurse to pass, the level of nursing care, a nurse to pass a simple 1-week exam, it's a weekly exam, was that she has to tell the patient, "Look, you can fall down." Are our nurses trained like this? Do we have that category of training or monitoring of quality? That is why I think one thing is there, that first we have to be clear what our lines are. I am very much in favor of nurse practitioner because she will be very good in talking. Nurse practitioner is a person who, under the supervision of a doctor, as you know, will do all that. But here doctors themselves, then they will pass on the buck. "Look, you are under problem, legally you are there." So I think unless we are clear on our playing ground, we probably should not be starting this.
Good. I think let me take it a little beyond the nurse. We were outside for some time, and in that country, when you have these school exams and you have this examination hall, everybody is taking these exams. In that place, the student will not want to copy from the next candidate. No invigilator, only one person to distribute the papers and take it. This boy will come and give a blank sheet, but will not want to copy. They have all the provision to copy, nobody is going to stop them. They will not. "Why do you not copy? What happened?" So what do you mean copy? I don't know. But no, it does not matter whether I have cleared that exam or not. In our country, it is very important that we have that degree, irrespective of pragya, whether we have acquired the science, the skills and the art behind it. And actually it should come from within. Only then you will pick up the art and the skills. If it does not, it's not for medical field alone. That is why I brought it up. It is applicable across the board. So we can take a quick round for a couple of more questions. Yes, sir. Sir.
My name is Karthik. Since you asked for suggestions, one thing strikes me, that when you say this thing about fatty liver, why is it necessary for you to say it to us? Why is something like this not made a part of a child leaving school? Because this can be assimilated in class 12. or much earlier. So nursery. So why, as a profession or as a group, as a pressure group, do you not say that this is the information which we want every child who is leaving school, getting a degree, getting a school leaving certificate, that this is the health information which a child should have, and that if that becomes part of the examination, will it really be strongly opposed? Or is it something which doctors can get together of basic information which every child in India should have?
Ji.
I am Dr. K.D. Sikka.
Ji.
I fully support the views expressed by Mr. Salim.
Ji.
An MBBS doctor must practice a lot on the ground. Then his fame spreads. People know that he is the right doctor. But in my case, I am around 81. I checked this point from the community, which is the best doctor. Once I go to that doctor, I never change the doctor under any circumstance till he dies. My dentist has died, my homeopathic has died, only the one physician.
You're right, because he's a good
patient to have.
Because he's a
You see,
good
people go changing the doctors.
See, because he's a good doctor, he dies before the patient. Yes, sir.
I don't have a question, but it is related to something which Mr. S.K. Sareen mentioned. You said, you mentioned about some portly people who are fat and who are diabetic, who go to Gymkhana club and it's a threat to their life. But I look at it very differently. As their lifespan is likely to be short because of the risk factors which you mentioned, and they are doomed to die. So don't you think they might as well enjoy the last few years which they left with them? I'm giving you from practical example. My neighbor downstairs, he's got stents fitted in different parts of his body. He is diabetic, he is fat, and he is a member of a club where he goes. And I asked him what is the secret of his longevity. He says that I have got zest for life and that is keeping me going.
Winston Churchill. Another one. Yes, sir.
Yes.